Good afternoon. My name is David Denning, and I lead the Global Action Fund for Fungal Infections, which is based in the UK and Switzerland and is working to improve the outcomes of patients with fungal disease globally. GAFFI's mission is to really enable health systems in low and middle income countries to really diagnose and treat fungal disease much more effectively than is currently the case. And one of the mechanisms for doing this is working with the WHO on ensuring access to essential diagnostics and essential medicines. I'm very happy to report that on Friday, the WHO announced and launched its third list of essential diagnostics, which includes 175 categories of tests. And amongst these were several that are relevant to fungal diseases. So one of the recommendations they made was to include Aspergillus antigen. And as you perhaps know, this is available as an ELISA or as a lateral flow or RDT test, and is very important for the diagnosis of invasive aspergillosis in immunocompromised patients, but also is useful from respiratory samples in patients with chronic pulmonary aspergillosis. The WHO also accepted Aspergillus antibody as a test, particularly in the diagnosis of chronic pulmonary aspergillosis. It's also useful in patients with subacute invasive aspergillosis and allergic bronchopulmonary aspergillosis. And the value of this test has been substantially increased recently because a new lateral flow assay has been introduced by a small company in France, which performs really very well indeed, with a 92% sensitivity and 98% specificity, which is really important, and it's inexpensive and quick. And the third assay that the WHO accepted onto their essential list last week was Pneumocystis PCR for Pneumocystis pneumonia. And this is obviously particularly relevant in immunocompromised patients. We think that on any one day, there's about 13 million people at risk of dying of a fungal infection, and probably about 2 million deaths, which are disguised under other causes of death, such as leukemia, lung cancer, HIV/AIDS, TB, COPD, respiratory infections, and so on. And about 50% of deaths in HIV are due to fungal infections as well. And we think that with good diagnosis and treatment applied across the world in all societies and health systems, that about 1.3 million lives could be saved if this was done in a systematic way. And with that, I will leave you and thank you very much for the opportunity to introduce World Aspergillosis Day 2021 to you. This is very important, as this is one of the more difficult fungal infections to diagnose and treat. And we hope that this meeting will be helpful to you in encouraging improved outcome from these patients. Thank you. Thanks very much.